All right, we are back with To Your Wellbeing. Dr. Gayatri Acharya is here, and she is with Cone Health Medical Group Heart Care at Northline Avenue. We were just talking about what are the preventative things that we can do right now to prevent heart disease. And let's talk about physical. What can we physically do?
I like to keep this really concrete and make it make a lot of sense for my patients, which is just get 30 minutes of activity a day. The American Heart Association recommends 150 minutes a week. But sometimes that's a bit of a kind of, okay, how much do I need to do? 30 minutes a day. Climb the stairs, walk, park far away and walk into the grocery store, and add those 5 minutes at a time to your 30-minute total.
Okay, so move more. That is number one. All right, how about our diet? Can you give us some examples of things to eat or not to eat for a healthy heart diet?
What we know right now about healthy diets for the heart is that a primarily plant-based diet with a lean protein source is really going to be the best thing, whether you choose to make that plant-based protein, which, plant-based diets are really kind of emerging as a heart healthy diet, even more so than we thought before. But some healthy things would be fresh fruits and veggies, lean meats and fish, healthy fats like avocados and olive oil, and then a really small portion of nuts. And then they leave a little room for some indiscretions, meats and cheeses and things.
Cookies and other things like that.
I ideally keep those in moderation. I tell my patients, if you like steak, you can have a steak on your birthday and your anniversary, but try to really limit it to sparingly.
Okay, let's talk about alcohol consumption, because that really was an issue, especially during COVID, the pandemic, 2020 and 2021. What is moderate alcohol consumption, and what is that the equivalent for men and women?
So the Mediterranean diet really is the diet, one of the most heart healthy diets that gives a recommendation about alcohol. Really the only alcohol that's been shown to be heart healthy is red wine. And it ends up being a 5-ounce pour for men or a 3-ounce pour for women, ideally not daily. So the kind of party line is none is best, but that much in moderation is really what's felt to be heart healthy and not dangerous.
All right, so many of us, especially women, think of heart disease as a man's disease, right? They're the ones that are having the heart attack, but that is not the way that it is.
Not at all. It equally affects women, and in fact, women have some unique risk factors for heart disease. The inflammatory conditions one might see a rheumatologist for, we know that those folks are more prone to getting heart disease in the future earlier than others. And pregnancy itself, as part of pregnancy, we watch for heart failure after pregnancy. It's not very common, but when it happens, it has to be addressed right away. So absolutely it can affect women.
All right, well then let's talk about the differences, because I think, we've seen movies and television shows and things, and we always see the guy, clutching his chest or whatever. So how does heart disease show up in women different than men?
So men and women both can have the typical symptoms, which just as you described, the elephant sitting on your chest. But I have a lot of female patients that come and say, I was dragging my trash bins to the curb and I just was so short of breath, or carrying that laundry basket up the stairs and I just was so terribly winded. Shortness of breath, particularly with activity, that's something I think you should go see your doctor about. But some of the other ones, sometimes people will talk about an indigestion that just doesn't respond to your typical heartburn medications. So those are really two of the big ones that a woman could come in with.
All right, and so what are the two myths you would say about heart disease that you kind of want to debunk, since we have the time to talk about it?
Right. So the first one is, if you have a family history of heart disease, you are not doomed. And I have a lot of patients who almost throw in the towel before they get a chance. We have so many tests and therapies that we can use for prevention, or at least to kind of stave off that heart disease. You can't change your genetics, but you can certainly, there's so many more things available now than there were for our parents and grandparents' generation. So we can really attack things early and try to prevent the same diseases that affected your family members. The other myth I would like to debunk is that if you've had a heart attack, if you've had heart failure or a stroke, this is not the end of the road for you. We can work together to have really full and meaningful lives for these patients, active lives. Again, we have therapies that can help that specific population of patients, where we call it secondary prevention. Let's hit it after we know it's happened. And those are two things I want my patients to know.
All right, with COVID still in our community, even though things are lessening and that kind of thing, some people may still be hesitant to go to the doctor or the emergency room, even when it could be something as serious as their heart. What do you say to them? When do they need to go to the emergency room?
go at the same frequency and timing as you would pre-pandemic. I can't stress to you enough, do not avoid going in for fear of long wait times and things like that. I have to take a second to give a recognition to all the people who work in the emergency department, the doctors, nurses, staff, EMS. They've worked tirelessly for 2 years, but they still have they're looking out for you. And really the safest place, if you're having symptoms of severe chest pain, shortness of breath, or stroke-like symptoms, the safest place for you is the emergency department.
All right, and we've got just about a minute or so. You and I, during the break, we were talking about a specific test that folks are getting now that could really help out.
If you're not having cardiovascular symptoms yet, there's a test called a coronary calcium scan. It's a CAT scan of the chest, but it doesn't involve any contrast dye. And what it does is it screens for calcium in the heart arteries. We can actually count that calcium and do a little math and determine what your overall risk may be. And from there, we can decide, do you need a cholesterol medicine? And do you even need a further cardiovascular workup? So we save that for patients generally who aren't having symptoms to start the course of prevention.
All right, and we do want to make clear that it's not covered by insurance. It's about $100 or so. But I think to myself, that is something that weighs on my head. And so I think anybody else who has that in their family or is concerned about that, it would probably be money well spent.
Absolutely, and it can be coordinated by your primary care provider, or it can be coordinated by your cardiologist. Cone Health offers it, and so we'd be happy to do that for you if you come see us.
All right, thank you so much for your time and expertise. We so appreciate you. And we want to make sure that if you missed any of this about heart disease and how to prevent it, especially in women, that you go to our website, WFMYnews2.com.